Dr. Salmia Swaminathan, she is chief scientist at the World Health Organization. Thanks so much for joining us on G0 World.
Thank you, Ian. Nice to be with you.
So let me start with a quote from you. You recently said, "We cannot win the battle against this virus one country at a time," and that the gap in vaccine inequality worldwide is, quote, "becoming more grotesque every day." What's the state of the global race to vaccinate, in your view, right now?
Yes, I mean, you call it a race. It is a race against the virus. We should not look at it as a race between countries. A large number of countries, about 42, I believe, still have not started vaccinating their people, even their high-risk groups like healthcare workers and the elderly. And 3/4 of those countries are low-income or low-middle-income countries. So you begin to see here the real inequity between a few countries. They are high-income countries and vaccine manufacturing countries that are moving very rapidly towards vaccinating their entire adult population. That's the targets that they have. And a significant number of other countries, that account probably for more than 2/3 or 3/4 of the world's population, where even if they have received vaccines, it's very small volumes. They've only started vaccinating the very highest risk groups, and they really need to scale up rapidly in order to bring down deaths. We've seen in the last few weeks the global epidemiology again changing. There's been, unfortunately, an uptick in cases in all the WHO regions, with also increasing deaths. And this is very, very concerning, particularly since we now have tools. We have diagnostics, we know how to treat people better than we knew last year, and we have vaccines that we didn't have last year. And yet we're back to the levels, that we had last year of cases and deaths.
If you were advising some of the leaders of these wealthy countries, you obviously understand the pressures that they want to get their citizens vaccinated first. What is the right thing for them to have done, for them to be doing that they're not doing right now?
I think because it's a pandemic, we have to consider this problem as a global problem. And yes, political leaders, are answerable and responsible for their own populations. But this virus does not respect borders. It doesn't respect nationalities or religion or age or anything like that. It just spreads where it has an opportunity to spread. It only recognizes human beings. And so what we should have done, and what we've been advocating for as a WHO, is in the first instance to prioritize the high-risk groups so that we can bring down deaths. We've seen now in countries what a huge impact vaccines can have on reducing severe illness, hospitalization, and deaths. Tremendous. And the news from the vaccine is really encouraging. It's reducing deaths, it's reducing hospitalizations, and it's even reducing infections. So as we're learning more about the vaccines, we're getting more and more encouraged. But in some countries, you see death rates climbing every day because they don't have enough people vaccinated in those high-risk groups. So if we were to approach this as one global community, we would share the available vaccine supplies, which are no doubt limited. So for the first half of the year at least, supplies are definitely not going to be enough to meet all demands everywhere. If we could share those limited supplies in a way that everyone in all countries who's at highest risk of dying if they get the infection is protected first, then when the supplies are more, we could actually start vaccinating more of the adult population, which is where we want to get to eventually. If we have to control this infection, we probably have to vaccinate 70, 80% of the population of all countries.
We're probably in a situation where the entirety of the United States, the United Kingdom, Israel, other countries get vaccinated before many countries even get started, even get their first vaccine. That's what we're looking at right now. Aside from the fact that that means a lot more people will die, what does that also mean in terms of real-time spread of variants, the difficulty of actually fighting this pandemic globally?
That is the other real concern, that if we allow the virus to spread and multiply unchecked in some parts of the world, the more the virus replicates, the higher the chances of it accumulating these mutations, because this only happens when the virus is reproducing or replicating. So there will be then these variants that emerging that have already emerged and will continue to emerge in some parts of the world. And eventually we've seen how these variants actually spread across the world. There is no way to keep those geographically confined. And so a new variant that is less susceptible to the immunity that's brought about by vaccines and or that's more transmissible or makes people more ill could easily then spread back and infect people in parts of the world where there have been large numbers of people vaccinated and where they think that they are then immune. So I think it makes epidemiological sense as well to distribute these tools that we have fairly across the world so that you're damping down transmission in all parts of the world at the same time and not in an unequal manner as is happening now.
So many people now, as they are getting vaccinated, that are watching this show, I know we're learning more every day, but how comfortable should people feel? They've gotten their jab, their second jab in the case of Moderna and Pfizer. They've waited their 2 weeks. At this point, do you think people can go back to pretty much living their lives or not? And where would you make exceptions?
Well, I don't think any country is at the point where they can say, let's go back to living lives as we were before the pandemic. Even in those countries which are vaccinated, 40, 50% of their adult population, most of them have had a single dose. And unless you get both your doses, and a significant number of people in the population have had 2 doses, and you know that you've got that population level immunity, you can begin to relax a little bit. But I would say that for the majority of us at this time, whether we've had the vaccine or not, we still need to maintain the guidelines. We still need to wear a mask when we're in a crowded place or with a group of people. Try to maintain physical distancing as much as possible.
I'm going to ask you about the new WHO report that just came out that was looking into the origins of COVID-19 and hopefully shedding some light on that. What can you tell me that we have learned on the back of that report?
I haven't read the 300-page report, and it's obviously very, very detailed and comprehensive. It involved a lot of in-depth work that was done by the international scientists along with their Chinese counterparts when they went to China earlier this year. And basically, they looked at every possible hypothesis on how this virus could have made that jump into humans and begin to spread from human to human. And then they laid out the likelihood of each of those potential scenarios. And while they could not come to a conclusion on the origin of the virus, basically, which means that they have laid out a plan for more research and more work that needs to be done. But looking at the most likely scenario that this came from bats, because the beta coronaviruses are very, very common in bats, and there's a lot of genetic similarity between the SARS-CoV-2 virus and many of the viruses in the Rhinolophus bat species. And so a lot more work needs to be done. But how and where it moved from bats into humans and what that intermediate animal was, most likely they believe there was an intermediate animal like the civet cat for the SARS, the original SARS virus, and the camel for the MERS coronavirus. So those are still open questions.
I'm sure you've seen that the former US CDC director, Robert Redfield, has come out and said that he believes that this virus initially emanated from a biolab in Wuhan in China. Is that definitively not a theory that the WHO finds plausible right now?
It was the least likely. I told you that there were many different theories that were considered. Everything was on the table, but that was considered the least likely of the possibilities.
We all know that the WHO is the most important international organization that's tasked with coordination and education and fighting pandemics. We also know that the Biden administration has recommitted American cooperation with your organization. but there has been a lot of you guys in the crosshairs, both from Trump saying that you're basically an arm of the Chinese government, to now Secretary of State Tony Blinken criticizing the WHO pretty directly for influence of China on this report. I mean, you're a scientist, you're not a political figure. How do you react when the Secretary of State from the United States levels those allegations that your report was influenced by the Chinese government?
No, as you say, Ian, I'm a scientist, and I've been trying really to work on the science side of things, and that's been a truly rich and amazing experience to just see where we've come, in a matter of 12 to 13 months from when we first found out the genetic sequence of this virus, thanks to the Chinese scientists who posted it publicly on the 10th of January last year, which enabled all of these amazing vaccines as well as diagnostics to be developed, to all the other research that's been done, where we are today in a position where we understand the disease, the virus, the epidemiology, the transmission, and the modes of control so much better, and we have so many tools. So I've really been focusing on that and not on the politics. So I don't want to comment really on what anyone said, but it is true that WHO is a member state driven organization. And so I think, again, it's for the member states that formed the WHO in 1948 to think about its future and how it should be funded and given, empowered, really, so we can do even a better job than what we do today.
So before we close, let me ask you a little bit just about long-term trajectory. One is the children. You've seen that we have millions of kids that are out of school and some that aren't going to be returning as a consequence. I wonder, given the scientific consensus that appears to be that COVID is not widely transmitted at schools, why hasn't the WHO recommended that all students return to school worldwide?
I think that's a really good question. And, the evidence on this has been very mixed. Unfortunately, there haven't been very many good studies done on transmission in schools, and the evidence that's come from different settings has been mixed. And the reason for that is that schools don't exist as an island in themselves. They are part of the community. And whatever happens in the community is going to be reflected in the schools. So if you have a raging outbreak in the community, it is likely that you will have a lot of infections if you keep schools open. So that's why we've always said that, we need an approach to schools where we prioritize schools. We've always said schools must be prioritized over other things like, shopping malls or cinema halls or pubs and things like that. That we've advised governments, please prioritize schools.
When do you think the World Health Organization will be in a position to recommend that children should be vaccinated?
So the trials have started. Many vaccines are now being tested in children down to the age of 6 or even lower. I think there's going to be looking at safety, they're looking at dosing, and they're looking at the immune response. So as soon as there's data, as you know, we've put guidelines out for 4 vaccines so far. We have policy as well as we have the emergency use listing. And as soon as we have data on children, we will update those to include children.
You've said recently that better vaccines are coming. You can even see vaccines without needles. Can you talk a little bit about that?
Yes, so there are a number of vaccines in development that are being given either through the nasal route as a spray, and that would have a lot of advantages because it would generate local mucosal immunity in addition to systemic immunity. There are oral vaccines that are being developed, and there are also vaccines that could be given through the skin, through transdermal applications. So there are all of these innovative vaccine designs coming through. There are single-dose vaccines coming as well, vaccines that can be stored at room temperature. And that's why I'm so optimistic that eventually we are going to have a range of vaccines.
Have you learned personally more in the last year than at any other time in your life?
Absolutely. There's no doubt. I've worked on tuberculosis, and I'm appalled that we make so little progress in tuberculosis. It takes a decade to do a clinical trial and get a new drug as part of the regimen for TB. It takes 30 years, to get a vaccine from phase 1 into phase 3. And it's been very depressing. And just seeing what's happened with COVID gives me renewed hope that we can address some of our other public health challenges with the kind of global collaboration that we've been able to bring, to address this problem of COVID-19. It's a question of having that mission and that goal, and scientists around the world agreed to work together. It was just an unsaid commitment that people had, and that's what resulted in where we are today. So I hope we can do this for some of the other big killers like TB and malaria, hopefully HIV as well.
Dr. Soumya Swaminathan, thank you so much for joining me today.
Thank you.
Shortly after my interview with Dr. Swaminathan, the Director General of the WHO issued a statement about that report on the origins of the COVID virus and made it clear the investigation continues. He said, in part, although the team has concluded that a laboratory leak is the least likely hypothesis, this requires further investigation. As far as WHO is concerned, all hypotheses remain on the table.